Welcome to Hello Health's eLab ordering training video featuring LabCore. Once logged into your Hello Health account, locate the Labs tab at the top of your page. On the top right-hand side of the requisition page, you will see the option to order the lab from the blue link displaying Order Lab. By selecting Order Lab, this will open up a new lab requisition form. You will notice on the top of the lab requisition form, you will have the option to select the practice's location in which the lab is being ordered from. You will also see the option to choose the facility in which your practice is integrated with to submit the lab order form to. On the right-hand side of this page, you will see the option to search the patient in which you would like to order the lab on behalf of. When you order a lab from the Labs tab, you will notice this field will not have any patient information populated yet. Just type in a few letters of the patient's first or last name, and you will see the option to select the patient from the drop-down menu, and this will populate the patient card once selected. Below Search Patient, you will see the option to select the billing type. There are three options to choose from. Client, which allows the practice to receive the bill for the patient's lab order. When selecting Client, you have the option to generate an invoice when ordering the lab, just by simply selecting the checkbox below the drop box of billing types. The second option is to choose your billing type as Patient. This allows the practice to bill the patient directly. The third option is to select Third Party, which allows you to submit the bill to the patient's insurance company for the patient's tests ordered. We will be using third-party billing for this demonstration. If the patient has insurance on file, this will automatically be populated within the lab requisition after selecting the patient. If you wish to edit the patient's current insurance policy, you can do this by selecting the blue link of the insurance company displayed. This will present you with a window to modify and make any changes needed to the patient's current insurance on file. If the patient has more than one insurance company on file, please ensure to match the correct insurance company to the lab requisition. You can also add insurance by selecting the blue link Add Insurance, and a pop-up window will be displayed. Within this window, you can select the patient's insurance, the payer, and the precedence of this patient's insurance, whether it be primary or secondary insurance coverage, the policy number of the patient's insurance, and then select Save once all of the mandatory fields with a blue asterisk are completed. If you wish to edit any information in the patient's chart while creating the lab requisition, you can do this by simply selecting the three horizontal blue lines on the patient's card. This will provide you with a drop-down menu if you need to make any changes to the patient's demographics or payment information. Now moving along to the left side of the screen under Tests. This is where the practice can add the test by the test code or by name. When typing the test code, you will see a drop-down menu displayed of the frequently used test codes for this provider. You also have the option to select from the test panel by selecting the blue link on the right side displaying Select from Panel. In this section, you can also manage your custom panel and add your frequently used test codes. If you wish to remove a test code you have already populated, on the right-hand side of the test code displayed, select the blue circle with a minus sign inside of it. By selecting this symbol, you can remove the test code from the lab requisition. Underneath Tests, you can then type in the diagnosis code. You will see the patient's previous diagnosis codes and the provider's most frequently used diagnosis codes. On the right-hand side, you will see the section Collection Info. This section allows you to specify if the patient was fasting or if a specimen was collected. If you would like to send a courtesy copy, select Add a Courtesy Copy. The blue link will be displayed on the bottom right-hand side of the lab order. Once selected, this will display the option to select account number, fax number, or the patient you wish to send the courtesy copy to. If you would like to manage your custom panels outside of the lab order, you can do this by selecting your Admin tab and then go down to the lab settings. You will then see the option to manage custom panels. If you would like to default your billing type when ordering a lab, you can also manage this setting within the lab settings. You have 3 choices to select from to default your billing type when ordering labs. If you would like to default a certain lab facility, you can select the default settings in this section as well. If you would like labs to be shared automatically with the patient, you can also select the checkbox to ensure labs are shared with the patient by default, below with the default lab facility option. If you would like the lab requisition to automatically open after ordering, you can default this in the lab settings as well. Under the Shared Labs with Patient by Default option, you will see Automatically Open Requisition after ordering lab. Just simply tick off this checkbox and ensure to select the blue Save button when completed at the bottom left-hand side. Moving along back to the lab order, you will see a section displayed as Clinical Information. In this section, this is where you enter any information for the lab facility or draw station regarding your patient. Anything you enter in this section will not be reflected on the lab requisition once it's submitted back to the practice, if you may share it with the patient or not. Example, if a patient is afraid of needles, you can enter in this information here, and this will not be seen by the patient or reflected on the lab requisition. However, any information entered in the Reports comment section could potentially be seen by the patient if you choose to share that lab result with the patient. If you have a staff member who is starting the lab order and you would like the doctor to review the lab order before submitting it to the lab facility, you do have the option to select Save, and then the provider can review the lab afterwards. Once you have filled out all mandatory fields when creating your lab order, select Order Lab on the top right-hand corner of the screen. If the lab facility requires additional information, you will be prompted with additional questions once you have selected Order Lab. If the company you are ordering from is LabCorp, you will be prompted with additional questions that you will need to complete before submitting the final order. Once you send the lab order, this cannot be undone. If you want to cancel the lab order that has already been sent, you must contact the lab facility directly to request this order to be canceled. That concludes our Hello Health eLab training video featuring LabCorp. Should you have any questions, please feel free to contact us at support@hellohealth.com or by calling us at 1-866-779-1536.